Wednesday, May 3rd. Health and Human Services Committee meeting to order. There was a staffing issue with public access today, so the meeting's being recorded so we can post it afterwards on YouTube. Could everybody stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Moving on to item 3, public comment. I did not have anybody signed up for public comment. Kelly, did you? No? All right, no one for public comment. Item 4, approval of the April 5th, 2023 Health and Human Services Committee meeting minutes. Those were in your packet. Do I have a motion? Motion by Arstead, second by Covelli. Are there any comments, additions, changes? Right, seeing none, all those in favor of approving the April 5th, 2023 minutes, say aye.
Aye.
Opposed? None opposed. Motion carries. Item number 5, policy issues, discussion and potential committee determination. 5A, discussion regarding 2024 annual budget and policy recommendations from the committee. And we'll have 3 parts to this today. So we'll start out with 5A1, review of mandatory and discretionary program document. And I think we'll start off with Chair of the Finance Committee. I'd like to say a few words.
Well, thank you. There was a reason this microphone was here. Thank you for the opportunity. As you know, we're trying to embark on a new budgeting process that tries to develop a budget from the bottom up, if you will, with looking for committee input earlier in the process. And we gave a schedule to, and the county board approved a schedule in our March meeting. And this is the first time through, so I'm sure we'll stumble as we're walking down the path of that new process. But we're looking for input from the committees on trying to identify areas where they may want to see changes and or provide input into the development of the budget that ultimately the county board is the final arbitrator of how those dollars are spent. We met yesterday with the Environmental Resources Committee, and they raised a number of questions and concerns relative to the process that I think we're learning from and will continue to learn as we go. But when you look at this committee's role in the development, you have reporting relationships with a number of entities, including the Health Department, Social Services Department, Veterans Services, and then you have indirect reporting relationships with the ADRC, Adult Resource Disability Center, and North Central Healthcare that fund. In addition, there are nonprofits that fall within the purview of this committee exclusively, or with other committees, including the Community Action Program, the United Way's 211, and to a degree the women's community, which is also shared with the Public Safety Committee. What we're looking for is your review of those programs and looking at, are there areas where you may want to modify programs, levels of services, and make recommendations. And to give you an example, earlier this year, I wore a different hat as the past chair of the Wausau Policing Task Force, and we had the discussion relative to the crisis assessment response team expansion and the case management services. Those would be things that you may want to review and discuss at a committee level. We're also asking that you use the mandated versus non-mandated services that the administrator has provided to give some context, but he will say that not all mandated services are the same and not all are mandated at the level that we're providing, and there is some discretion within the mandated services, and some of the non-mandated services are critical to the quality of life, and there's strong support and rationale for keeping them. We're also asking that committees evaluate their fee structure. I know the Health Department has done a very good job historically of trying to look at those Licensing fees is a way of supporting the activities, but other opportunities and other programs. Some of them are constrained by state statutes and are set beyond the county, but to take a look at those. And again, this is a process where we're looking for input and directions that will be used by the administrator in developing his budget, and then ultimately will help guide us with the final arbitrator is that the county board when we adopt the budget in November. So I'll turn it over to the administrator.
Thank you, HR Finance and Property Committee Chair Robinson. I think Chair Robinson did a great job of kind of laying out the process that we piloted, I guess I'll say, at the Environmental Resources Committee yesterday. And I really do think those 3 questions that John referenced are a good starting point, because those are the real policy questions that we had a slide in the presentation, that budget kickoff meeting presentation that we provided. What programs and services do you want us to deliver? Now, as Chair Robinson said, a lot of that is constrained by state statute. There are things that the state requires you to do. And those are some of the things that we laid out in that mandated versus discretionary document. And I want to have a caveat to that. We are learning, and we tried to roll up a lot of that information, but I've already seen a couple of areas where I'm going to want to add some things, a little bit more detail. The Social Services Department is a good one, and I'll talk about that later. But use that document as that guide of what's required and what's not, with another qualifier. Very often the state says, we are saying that this is counties, you have to do this work, because again, counties are an arm of the state of Wisconsin, but it's far less often that the state says, and you need to do it at this level. So service level, which is that second question, is another key place to go. So number 1 is, what programs or services do we deliver? Policy question for the board, again, as constrained by statute. Second question, at what level? And that can mean a couple of things. Just for examples, it can mean speed, turnaround time, right? Like if you were applying for a permit through the health department, there's a level of service expectation. If I get my oil changed, I kind of expect that to be done. You know, if I drop it off in the morning and my appointment's in the morning, I should be able to pick the car up in the afternoon. What is your expectation? What's the public's expectation for permit turnaround? Because there's a different staffing requirement. If a permit turnaround is 60 days versus 180 days, that's going to fall differently in the queue, and it might be able to be done at a lower cost. But those are things for the board to consider. At the same time, quality is another great service level area to look at. I use the pavement ratings that the Infrastructure Committee has talked about, right? We have the largest highway system of county roadways in the state of Wisconsin. It costs a certain dollar amount to maintain that system, depending on the level of quality. You can have a roadway that is of lower quality and it costs less money to maintain it. We all know that, right? Intrinsically, if you have your driveway at your home and it's a blacktop driveway, and if it's like mine, it needs to be replaced because it is not a PACER rating of 7. It's far less than that. But if we're okay with having an average of less than 7, staff are going to develop a different plan for funding and maintenance than if you say maintain that PACER rating of 7. So quality, again, is another one. And the last one I'll talk about is target population. We have certain programs that we make available to certain individuals based on a number of things. The Fenwood Creek Pilot Project that we're talking about is certain programs tailored to that area, that watershed. To deliver those programs outside of that watershed might look differently in terms of cost structure. Same thing with the health department. Some of our nurse family partnership program, do we want to make decisions about target population? So those are just some examples of service level variance that can impact the budget. And then the last one, as Chair Robinson referenced, really goes to the other document I send out to all of you, and that's the departmental rates and fees document. There are certain programs we offer that come at a cost. The Parks Department is a great example, same with Health Department, but if you want to rent a shelter, we will make a shelter available to you at the Parks Department, but it comes at a cost. We have philosophies, and this is one insight we got from the Environmental Resources Committee that staff, maybe not today, but perhaps today we can talk about what's been the philosophy that's driven the development of those fee schedules over time. Is the direction from a standing committee, or perhaps it's a program committee, has that guidance been, we want 100% cost recovery? Or is it something else? So if you think about water testing at the Health Department, how do we want to structure our fees? Do you want us to cover 100% of the direct and indirect costs of offering that service? Or do you believe that it should be perhaps less because there's a public good component that might justify utilizing tax levy or some other revenue source? Those are determinations for the board. Staff don't set fees. Staff don't decide what programs or services we deliver, and we take guidance from the state of Wisconsin and from this board. So those are just some of the areas that we're talking through with the Environmental Resources Committee that they're going to focus on. In terms of timing, one other thing I'll offer is that really the most, I know it's a lot, and that was some of the feedback we got from Environmental Resources, was this is a lot of information. And I think all of us certainly agree with that. The most pressing determination is whether or not you want service X, we should stop delivering that, or you say, you know what, our priorities at this committee are different. We need a new program to target a certain thing. An example that was brought up yesterday was, maybe we should look at new programs relative to groundwater and water quality. Do we want to put new resources towards something? We need to know those two things. Stopping services, or increasing or adding new services, that's more timely than the fee part. We can load the fees and modify fees later in the budget process, but staff are going to need direction from this committee and ultimately from the full board through approval at the board level of those changes earlier on in the process, because that's going to drive how we build the budget. If we know we're not going to deliver, let's just say administration, if we get guidance from the executive committee, you know what, we no longer want to have a justice alternatives program. That's not mandated by the state of Wisconsin. You're not required to have a criminal justice coordinating council. If you say we want to build a budget that no longer does those things, we need time to say, okay, what does that mean? And quite honestly, we need time to reallocate those staff, or if the decision isn't to reallocate, we need to know that as well. So those are the most pressing things. Fees can come later. Service level is kind of in between, because that too is going to drive the budget. So most pressing, terminating any program, adding new programs, then we'd move on to service level and fees to follow. So I know that too, like all of these documents, is a lot to take in. Staff are here to, I guess, start with answering as many questions as we can. And if you do have questions about, well, tell me what this program is, and we can't get you the answer today, we'll come back with it. But I hope, Madam Chair, that was a good kickoff, and we're happy to take any questions.
Thank you. So we will start with that item 5A1, the review of the mandatory discretionary program documents, and then we can kind of move into the other two items. So I'll open the floor for discussion, questions. Do we want to go through any of these, or have our staff from the different departments give us an overview? What are people looking for today? Go ahead.
Thank you, Madam Chair. So looking at what Lance had just described is, and I listened to the ERC meeting as well, and it sounds like as far as the committee goes, we should be looking at policies instead of actual numbers in here to help drive the budget. Is that correct?
I'll start and then I'll turn it over to HR Finance and Property Committee Chair Robinson. The discussion at the Environmental Resources Committee, and I appreciate the question, it started out going toward, well, really focusing on levy. Like, what if we have a goal to accomplish with respect to tax levy? And I think where that conversation ended up is that the tax levy will ultimately be what the tax levy is. The only, as you know from the budget kickoff meeting, your operating levy is very much constrained by state statute. It is going to be what it is. It will grow by net new construction, whether that's somewhere between 700,000 and, if we're really fortunate, $1 million. That's going to be the levy. So and it'll be discussed at HR Finance and Property. The only other way that your total levy changes is by things that are outside of that operating levy. And those are limited by statute. It's libraries, bridge and culvert aid, if you choose to get in the business of delivering emergency medical services, and borrowing. And you can't borrow for operations. You have to only borrow for capital under state law. So really, it didn't make logical sense, I think, is where that committee ended up. Instead, they're going to talk about those programs and services. I did neglect to point out one other thing, and it was in the document that we shared, but it's that 5-year budget change by department. And the last couple of columns that we added, and it's in your packet, but it has percent of the budget that's due to levy. And that, again, demonstrates that idea that not every dollar in the county budget is created equal. And you'll see one of the oversight responsibilities you have, reporting relationships you have, is with social services. And their levy portion of their budget, I want to say it's 33 or 34%.
34.
34%. So cutting a dollar from the social services department across the board doesn't save you a dollar. That said, and this is one area where I will make some changes to this mandated discretionary document after talking with Director Krista Jensen, who unfortunately is ill today, so she couldn't be here. But there are programs within social services. There's a community response program that is 100% levy funded. So it's not as though every program within social services is 34% levy funded. There are some that are 100 on one end and some that are 100 on the other end. The total is 34%. That's why we really want to have the discussion. If you have questions about various programs, it starts with whether or not you discern that there's value there to a program. And then we can start to tell you, all right, if you think, oh, this program is really valuable, you want to keep it, but it's 100% levy funded, we can tell you that and you can make a decision, keep doing it. If it's not mandated, maybe we change service level. Those conversations will follow, but really it's starting with that program evaluation, understanding what the programs are, what the mandates are, and what the community need is, which I think you're really there to make those decisions. That's what you're elected to do.
Yeah, thank you, Lance. One of the things that comes to mind is looking at the mandated yes or no column. Take your example, social services. I only see 1, 2, 3 sections where they're not mandated. And I believe I heard you correctly that you said you were going to split those out on the cost of a mandated versus non-mandated, or not?
That's a great question, if we can do that. But I want to make sure I address two things. There are a couple programs so the social services area is an area where, upon further reflection, I think we can add a couple under the child services and youth justice services or child welfare services, where we do have things that we're doing that aren't mandated. I referenced the community response program. That is a child welfare service, but it's not mandated. Similarly, the conversation you had about the Family Keys program, it's a specific housing program that's not mandated. So I'm going to add those, and I apologize. We just had that conversation this morning. So you'll have a couple more columns that we can discuss as it relates to your question about being able to roll up overall program costs. That is more of a challenge. That's the idea that underlies priority-based budgeting. As you all know from the riveting document we sent you last year as part of the budget, that 600 and some page line item budget, we don't budget. Counties generally don't budget by program. They budget by department and then by line item. So to get to a program-based budget, there's a really great section within the Counties Association Supervisor Manual that you all received when you get each 2 years. It's that black covered book. And it talks about the various types of budgets and how counties generally do line item budgeting by department. Program-based budgeting requires a lot of analytical assumptions. So when we did the priority-based budgeting exercise back in 2017, and a lot of stuff has changed since then, so we really would need to, if you wanted to do that, we need to allocate a lot of staff time to do it. You rely on analytical assumptions. You'd ask me, Lance, how much of your time goes to each of the various programs within my department? And then I'd also have to allocate, one of the programs for administration is general departmental oversight. I have a lot of conversations with department heads about things as they come up. So 0.01% of my time might be allocated to, analytically to a health department program in terms of cost, there's a lot of assumptions that go in there. So it would be really difficult and very time consuming to do that. Of course, if the board says, Lance, we really want you to do this, essentially redo the priority-based budgeting exercise, I can bring a timeline and cost back to do that. It would be expensive and take time. So I don't have costs for these various programs. Some we do, some we have. We might be able to give you a hard number quicker. Like the highway department's a good example. We can tell you what we spend on county highway maintenance because they do job costing. They allocate every hour of a vehicle operation gets rolled into a project. But that is not the case for the rest of our departments. That's required by state statute for the highway department through our routine maintenance agreements with the state of Wisconsin. That's not the case everywhere else. I know that was a long and convoluted answer.
No, that's okay. I appreciate it. Is this
Oh, it doesn't sound on.
Hello?
Where is it on? Right there. So just to kind of build off of that question, is there an easy way, specifically for social services, I'm thinking, to show what programs are grant funded and the percentages that they're grant funded? I know a couple of them denote, like Elevate's a grant funded program, but to cut something that's, at least in my opinion, to cut something that's grant funded is not, ultimately affecting our bottom line.
I think that's absolutely one of the next things. If you have, I still think it's helpful, and if you take a different tact, that's entirely your prerogative. I still think starting with, regardless of whether something's grant funded or not, if it delivers a lot of value to the county, you nevertheless perhaps don't want to start with, okay, let's dive into the funding of it. We can do that later. Dive into whether or not you're interested in stopping that program. I'll give an example, Parks, Rec, and Forestry. There's a lot of mandated stuff in Parks, Rec, and Forestry, but it doesn't make a whole lot of, it perhaps isn't the most logical process to start with. Let's dive into the finances of our campground program. If you want to stay in the campground business or the ice renting business, that's the first thing. Because you are elected by your communities and you know what they expect and desire. We'll do our best on the finances side. I say this often in every staff orientation I do. We are different than private business. Private business delivers services to generate revenue. We generate revenue to deliver services. So we're never going to make profit. In fact, in many respects, statutorily, we're prohibited from doing that. So starting with looking at each of these programs and saying, you know what, we don't think this is as valuable as it needs to be, or this isn't as valuable as some other priorities we have, I think is a good place to start. We can get you the grant funding stuff for sure. As it relates to non-mandated programs, Elevate is a great example. Family Keys is another. We have, there are mandates for certain things, but the how, Elevate, is a grant funded program. If you want us to stop doing that, we can tell you what that might look like.
Yeah, keep going.
Thank you. And thank you, Madam Chair, for bringing that up, because that was going to be my next question. So the struggle that at least I had, and some others may have had last year when we were going over the budget, was are we getting our, let's say, return on investment, not necessarily monetarily, but socially, and the value of those programs, were we getting that return? So how do we measure that?
That is a question I think every county, and sorry if I'm jumping in and others wanted to. I think that's a real great question. How do you measure that? And our priority-based budgeting exercise can get to some of that, but what are the outcomes that you're expecting from any one given program? How do you measure, that societal benefit? And that's really important in the non-mandated section. In the mandated section, you can talk about service level, but you got to be in the business by state law, as opposed to, again, I'll use Parks, Rec, and Forestry. You don't need to have as many parks as you have. But when you look at the Parks, Rec, and Forestry budget, you'll likewise see it's not all levy funded. A fair amount of that is because we contract with the city of Wausau to maintain their more than 30 parks. The city pays for that. It helps the county because we manage a collective system, and it decreases our operational costs with some of the capital we have to purchase. But there's nothing that mandates you have a camping program, that you have as many parks as you have. But I can't tell you what the return on an investment of a park is. So that's a really great question, with me unable to give you a great answer.
Yeah, and it's a great question. The question becomes, though, literally in whose eyes, because the value of a program is dependent upon whose benefit is the program being provided to. If it's the general public, then the general public would weigh in. If it's a captive group, a specific group. Children, for example, that society may say, absolutely, we should be protecting children. So I think it's really going to be dependent upon the program and whose eyes you're viewing it in. It's really difficult.
Thank you, Chair. I'd like to just make a couple comments. Grants, I think you want to be careful when you start looking at grants and the cost of grants, because the grants reflect the contribution from a different source in the local match, and it doesn't necessarily always reflect the true cost of the program. So I think you want to be careful that you may have cost outside overhead costs, health department grants, are all of those costs allocated for others. So I think you want to, the desire would be to look at it programmatically, but that's a difficult issue. I'd just like to try to get at the issue of performance measures. One of the opportunities that standing committees have is to have the dialogue with the departments and programs throughout the course of the year, to bring them in and ask them questions, provide an overview of that program. Who are you serving? What results are you having? And that's not necessarily a process reserved for budget time. And I would strongly encourage the committee, if you have interest in a certain program, to bring them in and to probably set it up on a cycle to look at it. But I'd like to go back to where we are in what the roles of the committee are. And you just go through the budget process again. Later this month, you will have, as a county board, the opportunity to look at the budget priorities. Those priorities will be, how are we going to deal with new positions? What's the levy going to be? Again, some of those are constraints. How are we going to, what we do with health care costs? Those will be developed by the Human Resources, Finance, and Property Committee next week, and then presented to the county board later in the month. There will be, part of that discussion will be where are we relative to new positions and how, how will we proceed with that? But there's a separate process for the consideration of those. Later in July, you'll be dealing with budget assumptions and where is our revenue going to be coming in and other things. So this is really an iterative process, and there are opportunities. It's not a one and done. There we'll have opportunities to reflect if the economy goes south, we'll have to react and develop some different assumptions, and it may change the dialogue at the committee level. But it's a process where we're looking for your input early to try to shape that. And I think the new accounting and software program will give us additional tools in the future, but we're still working on implementation of Workday and other things. So hopefully in the future we'll be in a better position to do some of those analytics and the evaluations than we had with Kayenta, the old system. So keep asking the questions, but don't forget you have a role and an opportunity throughout the course of the year to do some of that program evaluation by bringing those departments in and asking those questions.
Thank you. Yeah, go ahead.
Thank you, Supervisor Robinson. And that's a great point. And since Laura's here, what's your take on being able to provide that feedback? So when it becomes budget time and we have to make some decisions, can you provide enough information on the services that you provide to be able to give us an informed decision on where we need to go with that?
So absolutely, that is our intention, is to give you all the information that you guys need in order to make an informed decision. And so, when we look at programs and services at the health department, and I'm guessing that the social services does this as well, a lot of new evidence-based programs have return on investment built into them. So like for the Nurse Family Partnership, it's actually, I have it here, it's 6.4 to 1 benefit to cost ratio, or $60,000, $428 per family served. So, there are evidence-based programs that have that built in and have that data. For certain programs like the Nurse Family Partnership, we just started. So we're in a pilot phase, and so we'd be able to share that information and what evidence that we have to show that it is providing value or make some recommendations. I think in the health department in particular, we are embarking on the process of reviewing our fees, because I think it's a really good opportunity for us to evaluate that and give recommendations to this body to see if that is something that would benefit the county.
Yeah, thank you, Laura. And I'm a data guy. So I love data. I love that feedback. Anything that we can do, to provide that data to help us make decisions is great. And Madam Chair, I don't know if we can get it on a near future agenda to have some department managers and folks come in and give us some data, at least give them enough time to collect the data and analyze it and bring it to us before budget time would be great. I'm not sure if we can do that. And if that would be a benefit to anybody else on the committee as well.
Yeah, we can definitely ask staff to bring that. I think next month Veterans Services should be coming to us, so we can make sure that that conversation is included, and then we can invite Mike from ADRC. Health department's here every month, but we could have something more specific if we're looking for that information.
Madam Chair, if I can offer a suggestion. Mm-hmm. I think that's something we certainly can do. If there are programs, I'm just looking at social services, for example, or ADRC, or any of our larger departments. Very often they deliver a lot of services, a lot of programs. If there are things you look through and it's like, hey, we really want to dial into a couple, that would be really helpful, because otherwise that's a lot of information for them to pull, and it might not be something that, staff can tell you, hey, these are our largest programs. Maybe those are the things you care about, as opposed to something that we really don't do a lot of. And if you want to start that conversation, we can do that. The only other thing I'll say, since Mike is here, and also, as was referenced before, you have a relationship in terms of reporting with the North Central Healthcare Center. I think it's important to point out, in my mind, there might be a difference in how you approach that. North Central Healthcare and the ADRC are governed by independent boards. So they are going to develop their budgets. This is perhaps an opportunity for this body as a representative for through each of those entities. You are essentially, for lack of a better term, an owner or a stakeholder. Give some insight or input into that process and asking the ADRC, you know what, we're really interested. This is a priority for us. We would really like to see if you can develop or target some of your programs to address these priorities. Because again, you're not going to be involved ultimately in the approval of the ADRC budget as we laid out in that orientation. You have an intergovernmental agreement that sets out the amount of funding absent agreement by each of the 4 members for it to change, which I don't think is very likely at any given time. North Central Healthcare the same way. The North Central Healthcare Executive Committee is going to approve that budget. That said, speaking for myself as one member on that board, and I know Chair Gibbs is the other from Marathon County, we'd welcome the input to say, hey, this is a priority that we then can task staff at North Central to build into their budget. But without that direction, I said this at ERC, without direction from the county board, Marathon County Board, my job as the administrator, this is how I look at it, is to deliver all of the same programs you previously asked us to, at the same service level you previously asked us to, charging the same costs you previously have authorized. And the only way we do that is by trying to be as efficient through data, like Supervisor Covelli said. How do we become more efficient delivering those services? And the great example is our change from the Start Right model of program delivery to the Nurse Family Partnership model of program delivery. You still have always authorized the nurse home visiting program. That's the program. We made a model change. That's the staff role of how. We made a change in how to save money because we had budget pressures while still checking off all the boxes of same program, same level or greater level of service, and same cost. So that's how we're going to build the budget, absent you giving direction. And I said this at ERC yesterday as well. By no means, I think, our Chair Robinson, myself, or Chair Gibbs saying we expect, or that I expect, here's a list from the county board of 10 programs to stop delivering. Like I said at ERC, all of the services that the county board has historically approved, they're widely either required or liked by the public. I'd love to walk in and say, hey, you have this low-hanging fruit. Nobody uses this service. Nobody likes it, and it's really expensive. Get rid of it. We did that 30 years ago. Those don't exist. You have a lot of things that people that you're either mandated to do or that people rely upon, have come to enjoy. Those are you're tasked with identifying those things. And people rightly always want new things too. The world has evolved. So I'm not looking for a list of 10 things to cut. If you develop those, we'll build them in the budget. But I really see this conversation being more on the service level side and then also the rate and fee side, which, as Laura said, it's really helpful. I think there's an opportunity for us to get a greater handle holistically on fee philosophy. What is the guiding principle behind our fees? The county board just recently made a change to the medical examiner fees. We hadn't looked at that in a great number of years before that. We really shouldn't do that. We should do that every year. It's a lot easier to understand as a consumer the price of a service going up by whatever your percentage is, 2, 3, 4%, as opposed to 4 years from now asking for it to go up 12. That's harder, or 25 if you haven't changed it in a great many years. So I think we have a real opportunity on the fee side. I don't want to jump to that because I think there's a lot of value, as was alluded to by Supervisor Covelli, understanding the programs, understanding the outcomes that the programs are aimed at achieving. I think it benefits everyone, and that's going to be a long process. So if there are areas that when we have these departments coming in on a recurring basis, hey, we really want to know more about these 2 programs or 3, we can target those. But if it's, hey, bring in outcomes for everything social services does, or everything the health department does, or everything the ADRC does, that's a lot. And I don't know that department heads can get that done.
Okay, but I can like narrow it down that if there are programs you want to see, just email me and then we can make sure that those department heads are
Yeah, I think
prepared
that just
for
a
that.
follow-up, and thank you for pointing that out, because I really wasn't expecting, every detail of the report, and I probably could have said that a little bit better, but, just a high-level summary would be great, and something that, and maybe even ideas on where you think we can expand some programs or, whatever, if it helps benefit the community, that would be welcomed as well. But definitely no details, please. I think that would be a very long meeting.
Supervisor Leahy, and then we'll go to Supervisor Krause.
Thank you. Another sort of follow-up, I guess, to that last discussion, and probably more of still a general question. So last budget cycle, you did mention a couple of times that part of your process is talking with each department head about cutting a certain percentage from their operational budgets, and that most of them adhere, if not go beyond that advice. Still, at the budget hearing, we had amendments to further across the board make cuts. And after talking to department heads, we kind of realized like, that's kind of messy, and that's going to have consequences that we haven't considered. So I guess my question is, I think that mentality is still going to persist this budget cycle, regardless of the policy questions and deep dives into programs that we have. So I guess I'm wondering, at this committee level portion, should we be discussing that advice, that conversation that you have with department heads, and also in reality, how much benefit or effect could that really have to a line item budget? That number that we pick,
I think to a degree we're trying to not have that situation repeat itself by going through and establishing the priorities, working on the assumptions, and receiving the input on levels of service that are there. I think one of the reasons we're here, and when you look at the committees under your jurisdiction or the programs under your jurisdiction, the health department's at 54% levy support. Social services is at 34%, and veteran services is at 94%. So $1 in each of those, if you're looking at affecting the levy, is different. Your best bet is to cut veteran services because 94 cents are levy. Is that a desired outcome? No. But I think what we're trying to do is give you the information on which you can better understand that not all dollars are equal. When you go across the board, there are consequences in terms of match, in terms of other things that have ramifications, and the ripple effect sometimes becomes a tsunami. And we're hopeful that as a result of this engagement process, and again, those priorities, those assumptions, those levels of service, that won't repeat itself, because you'll have a better understanding of where you can provide input, what those opportunities are, and at the end of the day, have a much higher level of confidence in understanding of that process.
And if I can add, going back to where you started the question with what direction have I given to departments? And that was actually a question that was asked, and that I don't think we got to be able to answer it through the Q&A portion at the end of the meeting based on time, and we'll do that later. But my direction to department heads has been driven by the priorities of the board. But largely within budget constraints, I'm asking them to do exactly what you said. I don't give them control. They don't have control over the personnel side, right? The county board, you are going to set what we get, how much we're going to put into compensation. That's one of the things that HR Finance is going to talk about and that the full board will consider. Do you want to put in 2, 2.5, 3, whatever that percentage is for compensation? Staff then administer it, but I don't let departments ratchet that back. They make decisions for individual people, and I shouldn't say ratchet it back. I certainly don't let them exceed it. They have a ceiling as to these are your dollars to move within the personnel side. And there's a reason for that, because also it's not something that they can control. For example, within any department, the difference between someone accepting our health insurance and going to a single plan. So if they don't take our health insurance, no cost, right? No cost on the health insurance side. If they take our plan as a single individual, it's approximately, these are approximate, $8,000, let's just say. If they go to a family plan, it's $25,000. That's not in their control. If someone retires that their spouse was employed through the school district or some other employer and they took their insurance, and now we hire someone and they're on the family plan, that's not the department's, it's not within their control. We're not going to say no. Corp Counsel would be very involved in that conversation if we were starting to say, no, we're not hiring people based on those reasons. That's not how it operates. So that's not how the budget works, for very good reason. And in a small department, Supervisor Robinson brought up veteran services. My directive to certain departments, large departments, to say, hey, look for opportunities to cut 2% or 3% from your operating budget to essentially offset the personnel increases. The ability to do that in the Veteran Service Department is fundamentally different on any given year than it is with a larger department where they have other revenues. That, as Chair Robinson said, the revenue stream for Veteran Services, and Jill is on the WebEx if you have further questions, but I'll just say their revenue is pretty narrow in terms of various streams. They don't charge for services. It's levy and grant funded. They also are very small, a very small department. Jill has done an exceptionally good job of being efficient, but there are only a few expenses they have that they have control over. The training budget, they have a software budget. Well, the software is what it is. We made a move to a much more efficient veterans software, but it's a little bit more expensive. In Jill's budget, a little bit that's all of there's no fat to be trimmed. And there are going to be times when we're going to need to actually increase their budget beyond what other departments might experience. We have an example for veterans. If we have staff turnover within the veterans office, it's 3 people. Their training budget needs to increase because we need to fully train a new person. That's going to cost additional money that isn't in their budget. So the directive I've given has been driven by the county board, but some departments are able to do that on a given year. Others aren't able to accomplish it, but what I can tell you is we sit down and have I think it's an enjoyable budget meeting with every department head. I'm sure that other department heads say it's less enjoyable, but we go through line item by line item, and I say, help me understand, is this necessary? And we go through, and there's not identifiable, in my mind, there's not a whole lot of identifiable areas. Oh, we should easily cut there. That doesn't mean that in any given year we don't have a gap in what we spend, but that's because circumstances change and we don't need to spend it. The assumption in building the budget was still valid that we were going to spend it. I'll give you another example. In training, I just met with the emergency manager this morning. He's an office of 2 people. His training budget, he had a new person that he hired at the end of late last year. So we built in training this year. We trained that individual, sent them to a bunch of training. Well, they're from Pennsylvania. They just got a job and moved back to Pennsylvania. So that training budget is gone, and now we're going to need to train. We did just hire somebody. They're great. But we're going to need to deal with that too. So in small departments, it's hard. So that was more than you probably needed to know, but it's why we start with the program areas and what can we really do. Every budget is every department is different. The rates and fee philosophy, though, I'm really excited about. We've talked about it since I got into administration 7 years ago about needing to do it. I think this idea of incorporating it into the budget process is a stronger way to do that. And every year you see them.
Go ahead, Supervisor Crosby.
Thank you. While we have the Health Department, Social Services Department here, and that's something that the Health and Human Services Committee directly relates to, I was wondering if I could ask you a few questions, and if you're not prepared or need to get that later to us, that would be great. But since you're here, I thought it might be good to hear from you and have your input on this. For the health department, says expenses were $5,063,598, and the revenue was $2,307,606. I was wondering if you could tell me if you could mention, the largest part of your expenses and the largest part of the revenue for your budget.
So in 2022, which I believe this is based on, we did have the impact of COVID. So we were getting COVID funding, and so a large expense was personnel related to COVID in contact tracing and contracted staff to help with the related efforts of contact investigation and tracing. And so that was a large expense. I mean, the biggest expense of our budget is personnel and the costs related to personnel. And that continues to be the biggest expense for us.
Okay. Your revenue for income coming in, what would be your?
So we have a number of different grants. I think the last count we had was we have 39 different grant streams, so it gets very complicated very quickly. We do have, we can get some information about the proportion of levy. I know it's in our annual report, our proportion of levy versus grant funding. We do also accept some Medicaid billing, and we do accept fees for licensing. And so the majority, I can get out the pie graph, and I prefer to point to the pie graph when we have that. Oh, you have that up, Lance?
And I just want to make sure we kind of stay on topic today. So if these questions are going to help inform the discussion on the programs that we provide and the direction that we're giving, then I think we can continue with this. But I think if this is just, questions about the health department, we can do what we were talking about earlier, is invite the health department to come, have an agenda item where they talk about their programs, and we can make sure that they're prepared.
I know,
to answer
I just
them.
wanted a general information now. And then the social services, what would be your area of greatest expense and your area of greatest revenue?
And we don't have the social services director today, so
I can
Administrator
jump in.
Leonard.
So just to show on the health department, you referenced the revenue numbers. I want to make sure everyone understands the chart that's up. The expense column on the far left is total overall expense. The revenues in the kind of what I'll say second from the left, that is non-tax levy revenue. Tax levy is the next column over. So when you see those two numbers added together, the revenue and tax levy add up to expense. That's a nice thing about county government. It makes it simple. Our revenues will always equal our expenses. As I referenced before, we don't generate profit. So revenues you will always have a balanced budget. You will always have revenues equal expenses. As it relates to social services, in that 5-year, much like the health department, the largest component of the overall budgeted expense of that almost $22 million is going to be personnel, by far. I say in our orientation that delivery of government services is a people business, and that bears out in our budget. So you'll see there with revenues, this is a perfect example of how HR Finance and Property Committee Chair Robinson referenced that every dollar is not created equal. $14.5 million is coming in of revenue that is not tax levy. So that's as Christy explained during that budget kickoff, that's grants, similar to what Laura talked about. It's state contracts for service or state aids. We have child and youth aids that come in for us to deliver services. So grants, state aids. Then the last component, the last third of that, $7.4 million, that is tax levy. Again, that's not across the whole department. I shouldn't say that's not equally the case against all of the programs across the department, but that is that component of I like to look at it levy and everything else. We don't have too many, as you can see in the rates and fees document for social services, there's not too many areas where social services is charging fees because that's not their business. That's a little bit different than the health department. Fees, program fees probably make up more percentage-wise of the health department budget than they do in terms of revenues than they would of social services, because Laura's got programs, her department, Kate oversees their environmental health, so they're doing restaurant inspections. You'll see when you get to the rate and fee document, we're doing water tests for residential wells. We're doing pool tests for hotels and other establishments. Those things are fee for service driven, which again, not every department has that makeup. So the revenue, that pie chart, as Laura said, is going to look a little bit different for every department. But broadly speaking, the tax levy is that second column from the right. The other revenues are the column next to it. The two added together will always equal your expense.
Thank you. So to bring the conversation kind of back to what we're talking about today, is there any direction from this body that we want to give the administrator about programs to cut or programs to add, or at least explore those things? Does anybody have anything today that they'd like to provide? And this isn't the last time to do this. We can have this conversation again, but it'd be helpful, like you said, to get him the information as soon as possible. Go ahead, Supervisor Crosby.
Yes, I know that this is quite lengthy and extensive. You know, and I feel totally unprepared to go into some of these other departments and, you know, committees that committees have jurisdiction over, and we don't. And it would take extra time and effort to go into other departments and other committees and look and see what they're doing and be critical and come up with some other ideas when we're really not in those committees. And I mean, I feel uncomfortable doing that. I don't, maybe some others don't, but you know, we had the same problem with the Energy Task Force, that some people felt uncomfortable going into an Energy Task Force when they weren't educated and informed on those areas. Thank you.
Yeah, everyone is welcome to attend all committee meetings and participate in this discussion, correct? Yeah, so if there are other committees you're interested in, go ahead.
If I might. Yeah, I don't think you were being asked to, you know, at this committee level, at this committee, asked to weigh in on other jurisdictions, other committees' jurisdictions. You're asked to look at the programs that are being utilized and under your jurisdiction, under your auspices, as to whether or not you see expansion needed in the programs and their social services, ADRC, health department. If any of those programs that they run are expandable, or do you see that there's need for expansion or contraction or change? You're not asked if you want to have a discussion about stuff at the highway. That's not going to be brought up here. That would be brought up when you had a discussion at the highway committee meeting. So again, each committee's, you know, even though it was in the packet, it's not being asked by this committee to look at those programs that are outside of the jurisdiction of the Health and Human Services Committee.
Thank you. So the only thing that comes to my mind is what Chair Robinson referenced before, was that expansion of CART and case management that we heard about from the policing task force. And I'm curious if anyone has a weigh in, Lance or John, about where you think that funding, you know, would it fall under North Central Healthcare? Would it fall more under Sheriff's Department, or how does that funding look? And then my other thought process with that is we're going through the process in the CJCC to talk about uses for the opioid funding, and I know that some people have an idea that maybe that funding could be used towards something like that. So is now an appropriate time to look at expansion of programs before we're done with that process?
Well, I think that it's a process, and after the presentation to this committee, Sheriff Billups, Bill Milhausen, Chief Blivens and Deputy Chief Barnes and I met with representatives at North Central Healthcare to talk about both the expansion of CART and the case management services. And they're in the process of developing potential cost. We had some cost estimates a year plus ago that I think were suspect. So they're looking at those in the context of the next budget, but the request was specifically for expanding the CART into a second shift and cover, evening hours and the weekend, and then relative to coordinated case management services. That was a ask that was in the process of being defined. So I would hope that in the near future we will have a better understanding of what those costs would be, and then what the approach would be and what the role of the various parties will be. Will there be an expectation that some of the requesting entities bear a portion of that cost? But it is being evaluated in trying to develop better budget numbers.
Great. I think that is a perfect answer. I mean, if you would like to.
I was just going to clarify for CART expansion, the way that program operates, if you don't already know, and I'm sure you do, but the crisis assessment response team is that partnership from law enforcement and crisis professionals at North Central. The county, again, this is a direct service for Marathon County, this program. So Marathon County is paying the North Central healthcare side. So that has been identified as a priority. It's in the North Central healthcare budget to staff each of those crisis professionals. And again, for context, your CART team currently is 2 teams, total of 4 people. So 2 crisis professionals, North Central, 2 law enforcement, and the law enforcement are 1 sheriff's office and 1 Wausau PD. So just for context of budgeting, Marathon County is paying 3/4 of that overall program because you are responsible for the 2 North Central and you are responsible for the 1 sheriff's office. If you expand that to be another sheriff's office partner with crisis professionals, you'd be taking on each of those pieces if it is truly the kind of what the vision was that was articulated by that panel of adding another shift. The only way potentially around that, and I think that's one of the things Chair Robinson referenced, is are there other municipalities that are interested in having a crisis assessment response team directly within their municipal boundary, funded by their law enforcement entity or their municipality? So just an example, not saying it's going anywhere, but the Everest Metro Police Department, if they were going to fund that, a portion of that, then Marathon County would be on the hook for the other half. But that's how that team works, because you, again, it's a direct service through North Central. You're responsible for all of the North Central piece, and if it's a sheriff's office personnel on the other side, you're also responsible for that. So right now, it lives in the North Central budget and also in the sheriff's office budget.
Thank you. So are there any other suggestions or questions that we have for administration to help guide him in this process before we move on? Okay, go ahead.
And just again, if it's anything from Mike from the EDRC, we can take back, and Kurt and I will take back this ongoing desire for more case management and crisis assessment response teams. Mm-hmm. I saw some nodding heads before that. So that is certainly something we can ask them to put into their budget to consider how to do that. But if you do have that feedback for ADRC as well, because they are developing their budget independent of the county board, please, that'd be real helpful. I don't know, Mike, if there's anything you want to add.
I would just welcome that feedback. If you have areas of priority in regards to the services we provide, or areas that you feel that we need to improve or do different things, I definitely welcome that feedback, because we are definitely looking at our budget in not only for this year, but subsequent years as well.
Thank you. Chair Gibbs.
Oh, thank you, Madam Chair. Just to be clear, you know, the request that has been asked of NCHC is to develop that budget and or develop what the cost would be to expand those programs, but understand that the result would be an additional revenue request or from Marathon County to fund that program through NCHC's direct payment.
Thank you. Okay, so then we will move on to 5A2, the review of rates and fees document, which is the document after this program one. So I'm not sure, Administrator Leonard, do you have any comments you'd like to make? Otherwise, I know the Health Department has some information to share or not.
I don't need to, contrary to my experience or your experience with me, I don't need to talk on this unless you have questions. But I do think there's an interesting discussion opportunity about philosophy. Right now, your fees, not to belabor this, but they're set for the Board of Health. The Board of Health reviews them, but they haven't been generally taken to the county board. And the Board of Health, as you know, doesn't set the county budget. All of you do. So, and I think that's not unique in terms of setup. We have the same thing with the Park Commission. Park Commission reviews park fees. ERC reviews conservation planning and zoning fees. And I apologize for all the acronyms, but you know, so you don't have that tie back to the full county board. And I think this fee document starts to give you that. So if you do have questions about, hey, help us understand these fees, I don't know that we can give you all of that today, but if you have areas you want us to look into, we can look into, hey, what's the philosophy behind this, if there is one?
Okay, so I think my first question, and Supervisor Krause, just looking, you know, social services, since they only have a few fees, and I don't know if you can answer this, is this something that they review frequently to determine if they're, you know, charging appropriate amounts, and then are there things that are state mandated, or what sort of impact can we have? Should the direction just be, you know, department heads make sure that your fees are on par with others?
Series of questions there.
Yeah,
I'll
I know.
do my best. You're right. Social services has a number. They have a very small number of fees, and I believe some of those are set by the state of Wisconsin, but we can look into that. And my thought is the child care certification. I think that's I see Mike nodding. I believe that is set by the state of Wisconsin. Similarly, with respect to, I think that should be 4D. No, that is 4D income withholding verifications. Those things may be set, but I can have Krista come in and talk about if you want. We certainly can give you information on those fees. If you have others that, hey, help me understand this, please just highlight them and we'll make sure to bring that back next time.
Okay, Supervisor Krause.
I don't know if I'm getting ahead of myself or not, but I was just wondering why the Transportation Department isn't considered a committee of the board and, you know, with certain goals and strategies.
Can you clarify? You're speaking about like Metro Ride?
There's a Department of Transportation in the county, one of the county, I don't know if it's a task force, but it's not considered a standing committee. I'm on the Transportation Committee.
The Transportation Coordinating Committee? Yes.
Yes. And I'm wondering why it isn't a standing committee. Is this something that isn't allowed by the state? It just seems to be a minor kind of committee with minor, you know, I'm wondering why it's not given a little bit more significance, because transportation right now is an energy issue, and it's also a safety issue with the roads and things like that.
And I'll allow Chair Robinson to answer, but I do just want to make sure we stay on agenda items today to not get into the weeds about other committees or departments.
Well, the Transportation Coordinating Committee is a requirement of the state statutes underneath 521, and it's prescriptive as to who the membership is, and they basically administer a grant and they go through a public hearing process. There is no county. Well, we have a county match requirement in in that is approved by the county board on an annual basis. But the transportation issues per se fall under the purview of the roads through the infrastructure committee, which is there. And if you get into the Metropolitan Planning Organization deals with transit, the transit improvement plan, which runs through, again, that committee. So there are reporting relationships through the standing committee, the infrastructure committee.
And the only thing I'll add is if you actually look through if you take a look at the mandated discretionary table that we referenced just a minute ago, and you look for statute 8521, you'll see it in a couple of places. The first is conservation planning and zoning, that department, as Chair Robinson referenced. That transportation coordinating committee is largely staffed by conservation planning and zoning, and they administer the county side of that 8521 grant. So every year you've seen Dave Mack come and talk about the $8521, but we don't, to your initial question, we don't have a Department of Transportation. We deliver that service as required once we accept that grant through a contract for services with two entities. One is the City of Wausau Metro Ride service, and then secondly through North Central Healthcare. So you'll see that 8521 shows up in a number of sections, not only under conservation planning and zoning, but then also under North Central Healthcare. And it's listed as demand transportation on page 48 of that mandated services packet. There's a reference to 8521. And in fact, in that on that same page, there's about a paragraph long description of what that program is and why the county's involved. So again, I'd look to page 48, excuse me, of that mandated discretionary packet for that North Central Healthcare reference.
So then it's under MPO, which covers more than Marathon County. MPO covers several counties, and Yiling Xiong is the chair of the he's the board member, and Dave Oberbeck is the co-chair, who's also a board member. I'm on that committee, and I'm also a board member.
Can I just want to make sure that this conversation is going somewhere that's related to the fees and rates schedule. So are you asking these questions in regards to rates and fees that fall under, one of the departments that report to us? Okay. Chair Robinson, did you have a response?
Well, as chair of the Metropolitan Planning Organization, it is it is created because the standard metropolitan statistical area in the Wausau area and is comprised of the immediate Wausau area municipalities in the county. So the MPO is a fully functioning within it. I think you're thinking of the Regional Planning Commission, which is a multi-county organization.
Supervisor Leahy.
Thank you. In regard then to the health department fees, for those fees that aren't state mandated, I guess what is the criteria for choosing that number? Are we looking at simply covering the cost of the service? What's the rates, that we are looking at these fees? If it's been a while, is it yearly? Is it impacted by who exactly is paying that fee, if it's like a public versus a business or something like that? What are just some of those basics, I guess, of how you look at this information and how we should be, how you would advise us, I guess, to make changes?
I'm really glad you brought that up, because really we need to establish what the philosophy is that we're going to be using going forward with these fees. Some of these fees have not been reviewed for 20 years, is my understanding. And the most recent fee that was updated was the pool fees in 2020. So we need to reestablish, what is common practice, what is best practice, and bring that forward to the board so that you have that understanding of what other counties are doing and why, and what is required of us. There are certain fees that are preset for us. There are certain fees that we have the ability to set. Some counties look to recoup all of their costs based on their fees. And so that is an opportunity for us that we haven't really gone through yet.
Thank you. Are there any other questions, comments? Go ahead.
My only comment, building on what Laura had said, if you have something you want the Board of Health to look at, and you do have a member of the Board of Health that's on your committee, a couple of them, right? So provide that input. Maybe the goal should be, hey, we want an analysis of, do we want to really set the bar equal to what other counties are doing, or do you want to cover the cost, or at least have those things be considerations? So whatever you want to be considered by the Board of Health when they undertake this analysis, or if you want staff to do it for other committees that don't have an oversight, or I should say a program committee. Board of Health has a program committee. Social Services has a program committee. Veterans does not, but Jill and I, to the extent that there are fees, or other departments, we can look at those sort of things. But without that guidance, it's going to be done at the program committee level. And to Laura's point, there's a lot of fees. I referenced the medical examiner fee before that haven't been evaluated for a long period of time. That said, through the annual budget process now, I think we're going to move beyond that because of how it's going to be structured. You'll see it every year.
Okay, I guess a follow-up then. If you are truly looking at this from sort of a, we haven't done this in a while, if you need that guidance, I mean, I think I would be comfortable saying that at the very least, yes, if you could give us that data of what isn't even covering costs at this point, if it hasn't been addressed in 20 years, that would be helpful. That feels like a no-brainer. And then, yes, I would love to see when it makes sense, you know, the comparison to surrounding counties. If our Parks Department is charging something outrageous, why would someone stay in this county to go camping if they could travel, you know, an hour and go somewhere much cheaper, things like that. But I think that would be helpful information that would let us help you make some of these decisions.
All right, thank you. Any other comments or questions regarding the rates and fees or requests? No? Okay, so then we'll move on to 5A3, the review of the 5-year department expense levy document. We have already looked at that for a couple of the departments. So there are any other questions or other departments that we didn't quite touch on that people had questions about? Okay. Yeah, go ahead.
I was just going to say, I don't want to leave ADRC out, but the same kind of question goes for any sort of fees for services that you require. I know you have a lot of grant funding and things like that too, but any data that you could give regarding updates that are needed would be helpful.
Okay. So before we move on and essentially adjourn, is there any other discussion about the 2024 budget process that we want to have during this meeting? Yeah, go ahead, Supervisor Arstead. Oh, Ron, could you handle that?
Just a question about the nonprofits. That seemed to be at the budget time issue for a lot of the county board members. Are there any of the nonprofits that would underlie into Health and Human Services?
Yes.
Great.
So it is a community action program with a subsidy of $33,757 to help with housing. And you have the women's community, which is jointly with the public safety and at $55,000. I think there's a $20,000 additional subsidy relative to the marriage licenses based on a county board resolution. But that's levy. And then there is the United Way 211 at $40,000. And I know that, for instance, the Public Safety Committee has had the Judicare mediation program in the women's community come in and give presentations through the course of the year. And that might be, again, an opportunity for you to have those discussions and ask what the level of service is, you know, at a meeting, so you can have a better understanding of why the county's engaged in funding those programs.
So if I can just add on to that,
Yeah,
if
go ahead.
there are concerns, and that's exactly what prompted public safety to have those presentations, people had a desire to learn more and better understand. My sense of those conversations was they answered all their questions and they understood why it was a good investment and why the board had been doing it. If this committee, I don't want to just give you interesting information for the sake of it being interesting. You can watch PBS. But if you do, like, hey, you know what? I'm questioning whether or not this is good value. If you want to have North Central CAP come in and give that presentation, we certainly can do that. If you want to have United Way 211, we can reach out to Jeff Sargent and have him come in. But I don't want to do it just to fill your agendas with information that I find interesting. So Supervisor Arstead, to your point, if there's some question in your mind as to whether or not this committee wants to make a recommendation that, yes, let's continue it, or no, let's not, happy to set those up. I know all the representatives from the nonprofits would very much welcome the opportunity to do that if there was any question.
Okay, if there is no further discussion, then Supervisor Krause, go ahead.
Yes, for future meetings, you usually ask what we'd like to have for topic for discussion.
Yep, I just haven't got to that part
I'm
of the
sorry.
agenda
I'll
yet.
wait.
Okay, it will be just a second. Okay, so we'll move on to item 6 operational functions required by statute, ordinance, resolution, or policy. We have none. Item number 7, educational presentations and committee discussion. We also have none. Item 8, next meeting date and time, announcements, future agenda items. 8A, committee members are asked to bring ideas for future discussion. Supervisor Krause.
Yes, since last June, the Supreme Court has said that abortion is illegal, and the state of Wisconsin has reverted to an over 50-year-old policy of not allowing abortions in the state. And I guess I'd like to have an update on that from maybe the health department or North Central Healthcare Crisis Center, on what's been going on. I have not heard anything